All right. Good morning, everyone. Ladies, gentlemen, distinguished guests. We are so excited to welcome you to the 2024 AMR Symposium, empowered by bioMérieux, with partners University of Toronto's Emerging and Pandemic Infections Consortium, the AMR One Health Consortium, Sepsis Canada, the McGill AMR Centre, and the Association of Medical Microbiology and Infectious Diseases of Canada, and a special thank you to Critical Care Canada, who's sharing their space with us as well today. My name is Jessica Blavignac, and I'm the Director of Medical and Scientific Affairs with bioMérieux Canada. Before we get on to today's agenda, we'll read the statement, Acknowledgement of the Traditional Land. We wish to acknowledge this land on which we operate, on which we are holding our meeting today. For thousands of years, it has been a traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. We also wish to acknowledge the devastating impacts that infectious diseases have had on Indigenous peoples in the past and the disproportionate harm they continue to inflict on Indigenous and other equity-deserving communities today. As a community, it is incumbent on us to ensure that our work does not perpetuate these harms and actively seeks to address health inequities in Canada and around the world.
Good morning. My name is Frédéric Dubé. I'm the Director of Market Access and Government Relations at bioMérieux. This year, the AMR Symposium aims at providing an update on global, national, and local government and policy priorities for AMR. To illustrate where Canada stands compared to other G7 countries on addressing AMR, to inform on the progress on the implementation of the Pan-Canadian AMR Action Plan, and to provide the impact of AMR on sepsis management and health outcomes. Please note that this first session is accredited by the Canadian Critical Care Forum. To start us off, I would like to invite Madame Julie Emond, Vice President and General Manager of bioMérieux Canada.
Thank you, Frédéric. Thank you, Jessica. Good morning, everybody. Ladies and gentlemen, together we gather to confront one of the most urgent threats to global health, antimicrobial resistance, AMR. This is not a distant challenge. It's here and it's now. And it's growing rapidly, actually at an alarming rate. By 2050, 40% of infections will be resistant to antibiotic. It is today disrupting healthcare systems. It is impacting our economy. And most importantly, it is affecting the lives of patients around the world. At bioMérieux, we recognize the critical urgency of AMR. That's why we brought together some of the brightest minds, most passionate advocates, and most innovative thinkers to tackle this crisis head-on. This morning, we're honored to launch a joint session with Critical Care Canada Forum and Sepsis Canada. These partners share our commitment to addressing the interconnected challenges of AMR and sepsis. Together, we're forging a collaborative path forward because fighting AMR really requires nothing less than cross-disciplinary, cross-sector, and cross-border action. This is a moment for bold leadership, a moment to unite, a moment to prove that change is not just accessible, but really it is about overcoming barriers and turn tide against AMR. It is within our grasp. Over the next 2 days, we're prepared to engage to transformative dialogue, spark innovative ideas, and build lasting collaborations. What are we going to do? We're going to explore cutting-edge solutions, including the power of artificial intelligence, precision medicine, and rapid diagnostic to accelerate our fight. We'll examine impactful global strategies from enhancing antimicrobial stewardship to driving public awareness and education. But this symposium is not just about education. It's not just about knowledge. It's more than that. It's about action. It's about harnessing the power of a united community to translate insights into tangible results. AMR doesn't wait, and neither can we. Let this be the gathering that inspires us, challenges us, and ignites a collective resolve to act decisively. And before we begin, I want to extend my gratitude to our incredible speakers, our partners, you as attendees, and my bioMérieux team. Each of you is a vital force in this movement. Together, we can make a profound difference. Thank you, and have a good symposium.
Thank you, Madame Emond. It's my privilege to introduce you Dr. Saad Salim, Managing Director with the Sepsis Canada Network.
Thank you, Frédéric. Good morning, everyone. On behalf of Sepsis Canada's Executive Committee, Drs. Alison Fox-Robichaud, Osama Lobaini, and myself, we would like to welcome you to the third AMR Symposium, as well as the CCCF Forum. I would like to take time to thank the CCCF Forum Organizing Committee, especially Drs. Ferguson and Munshi, for giving us this opportunity to collaborate. And also a special thanks to our industry partners, bioMérieux, for their continued support in connecting sepsis and antimicrobial resistance efforts. I am the Managing Director for Sepsis Canada, and my responsibility is to operationalize our network's objectives. You might be wondering, what is Sepsis Canada? Who is Sepsis Canada? And what is it that we do? Slide. Next. All right. Our vision is clear. Suspect sepsis, save lives, and support recovery. This drives everything that we do. And how do we achieve this? By bringing together a multidisciplinary team of experts across Canada and beyond. Our network is truly unique. We are proud to have almost 300 members nationwide, including world-class researchers, healthcare professionals, and patient partners. Our amazing patient partners are integrated, embedded into every project, ensuring that their lived experience as sepsis survivors inform our research and decision-making. We are also nurturing the next generation of researchers through our award-winning training program. If you're interested to learn more about the program, please visit us at the exhibition booth. That was shameless promotion there. So what does the team do? We've been addressing all 4 pillars of CIHR. And I know I'm not going to do justice to all the projects, but I'm going to be quite brief in terms of how we do it. So there are 3 teams, and each team has several projects that is happening. Team 1, Population Health, Economics, and Policy, their primary aim is to define sepsis using machine learning and AMR data. They're also evaluating economic burden of sepsis and identifying diabetes as a risk factor. Advocacy, knowledge transfer, and education, Team 2. They're working towards understanding sepsis knowledge amongst the general population and healthcare workers, develop knowledge transfer tools to address these knowledge gaps, as well as our robust education program. And our third team, Translation Biology, Clinical Trials, and Rehabilitation, is comprised of the National Preclinical Sepsis Platform, our Canadian Clinical Research Network, and a rehabilitation initiative that improves recovery and outcomes for sepsis survivors. Once again, I would like to thank you all, and please do take the time to visit our website to learn more about all our projects. Thank you.
Thank you, Dr. Salim. It's now my pleasure to welcome Dr. Niall Ferguson, intensivist at the University Health Network and at Sinai Health System, who is also the CCCF Congress Chair.
Thank you very much. It's my pleasure as Chair of the Organizing Committee for Critical Care Canada Forum to welcome you to our joint session between CCCF and Sepsis Canada and the AMR session sponsored by bioMérieux. We think this is a great partnership that we look forward to this year and potentially in years in the future. I think critical care is one of the coal faces of antibiotic resistance, where we see this in daily practice, and it has a major impact on our patients and patient care. So I think it's a very nice partnership, and I'm sure that our attendees at CCCF will welcome the opportunity to stroll over to the AMR Symposium and enjoy that for the next 2 days. So thank you again, and welcome.
So I'd like to thank you all, distinguished panelists. It feels empowering to hear there's a position and a concrete action working together on this plan to curb the AMR and the witness of Canada leadership in this mission. Now, the Honourable Minister Jones has a few words for us as well, so please listen to our video.
Hello everyone, I'm Sylvia Jones, Ontario's Deputy Premier and Minister of Health. Thank you for everyone involved in organizing this year's annual symposium on antimicrobial resistance. This week, experts, researchers, industry leaders, and policymakers come together to discuss the threat of antimicrobial resistance and the opportunities to fight it. On behalf of Premier Ford and our entire government, I would like to thank you for your work on this important issue. Under the leadership of Premier Ford, our province has become a hub of health innovation, research, and technology. And with our Your Health Plan, we are taking bold action to make innovative changes to build a healthcare system to last. We recognize that AMR is a global health concern, including here in Ontario, and the necessity of responsible antimicrobial stewardship. That is why our government continues to track and monitor trends related to antimicrobial resistant organisms, with Public Health Ontario, a leader in scientific expertise on AMR-related matters, to share best practices to reduce the transmission of antimicrobial resistant organisms in healthcare facilities, and strengthen our surveillance on infectious disease trends. Our government is also doing our part to strengthen infection prevention and control through investments in infection prevention and control hubs, which support congregate living settings with their implementation of IPAC best practices. As we begin World AMR Awareness Week, I want to thank you again for your contributions to addressing the challenges that AMR poses and protecting the health of Ontarians and stability of our healthcare system. I hope you have an informative and engaging symposium. Stay well.
For the second year in a row, Ontario has expressed interest in working with diverse stakeholders and partners to help address AMR. It is meaningful to be able to secure time with someone like Minister Jones.